Hello and welcome back to 90 Day Dental Day 45. So we're halfway through the series, but we're also halfway through talking about laser dentistry. Yesterday we concentrated on the physics of lasers and how they work in dentistry. Today we're going to talk about the applications of soft tissue lasers and what sort of procedures we can use them for. So give me 2 seconds and I'll get to a computer. Right, hi and welcome back to 90 Day Dental Laser Lecture number 2. So we started yesterday talking about the physics behind some of the concepts of laser dentistry, but today we're going to delve into a bit more clinical work, which I know what a lot of you are sort of looking into. Just to mention, a lot of this is what's mentioned on our course that we run by Build, which is usually held every couple of months. And it will cover a lot of these concepts. It's a hands-on course that explains how laser dentistry works, all the different procedures that it can be used for, soft tissue laser dentistry, all the different procedures that it can be used for, as well as a hands-on in the afternoon, actually practicing all of these procedures as well. If any of you are interested in that, please do PM me and I will put you directly in touch with Build to consider any more teaching and courses, etc. So, we mentioned briefly yesterday about some of the potentials and the various options that we can use lasers for, and there is a very wide array. So with soft tissue lasers especially, we're going to be talking about all the coagulation, ablation, photobiomodulation and decontamination options, which are mainly what's covered by soft tissue lasers, and in our case especially diode lasers. So we're going to run through a couple of the options that we can use them for, and these are the things that I personally use on a day-to-day basis, and what I would use in normal general practice. I am a general dentist at the end of the day, same as a lot of you out there, and what soft tissue diode laser allows me to be able to use this for a lot of the cosmetic procedures that we have. So one of the most basic and the easiest processes to use it for would be gingival recontouring, which is something that comes across to us on a day-to-day basis. And it's very easy as long as we respect the biological width, which has been explained by previous lecturers before. As long as we respect the biological width, it's fairly easy to be able to utilize a soft tissue laser and get some outstanding results on there. And a classic case like this one is one where after removing the excess gingiva and matching the two upper centrals with a soft tissue laser, very minimal post-op pain, very minimal cleanup time afterwards, and actually 3 weeks later we've got a beautiful gingival margin on there. Very similar with gingival hyperplasia. So another classic case. This is a drug-induced one, so obviously there is a more to this case than just reducing the bulk. But we can use the laser to reduce the bulk on there, and once it's healed a couple of weeks later, it should actually settle very, very nicely and reduce back down to normal levels. Impression troughing is another classic one. You can use a retraction cord, but actually I do tend to use it in posteriors quite often, as it's quite useful and quite handy, especially if it's there and set up already. And actually, it just allows you to be able to grab the margins in so much more accurate detail, whether you're going to be scanning the end result or whether you're going to be taking an impression. And it allows you to be able to grab that detail, and your technician will absolutely love you. Another classic one, you've got the end. Once you have access to a laser, you'll always have the constant debate as to whether you're going to remove the operculum on a wisdom tooth with the laser, or whether it's going to be removed surgically. The advantage you've got with the laser is it's quick, it's easy to do, and the healing time is very quick as well. The disadvantage is if the tooth doesn't erupt through within the next year, then the chances of it occurring and regrowing are going to be there. And that's a conversation that would need to be had with the patient based on their own clinical need. But for a lot of these cases, it's very, very easy in pericoronitis cases to be able to treat it. Ulcers is another classic. And with ulcers especially, we're looking at helping the area heal quicker. We're not using the laser to remove the ulcer. We're using the laser to actually help the margins of the ulcer around it to heal much, much quicker and allow the body's repair mechanism to be activated. And what would normally take an ulcer 10 to 14 days to fully heal and disappear could be done in as quick as 1 to 2 days for a lot of these patients, especially patients that are in a really high pressured environment with a large amount of stress and suffer from stress-induced ulcers. These types of treatments are very, very useful for them. Another use is in periodontics, and there's a wide array of options, but the ones I'm going to touch on very quickly are sort of as an adjunct to normal perio treatment, which you can use for non-surgical periodontics. We spoke earlier about non-surgical periodontics with Ian Dunn, looking at the options of root surface debridement. And actually, as well as doing that, we can utilize a soft tissue laser to be able to, again, activate the body's repair mechanism and induce healing so that the pocket starts to reform and reattach back onto the tooth surface once all the debris is removed. This is a freenectomy case, which is another classic. Again, really useful in these cases. Usually done surgically, and that's post or pre-ortho based on your beliefs and findings and what you prefer. But actually, it heals so quickly. Very little post-op pain. We can see the top photo is the post freenectomy that's been done with a soft tissue laser. 3 weeks later, with the bottom photo, it's healed up really, really nicely. Second stage implant exposures. Again, really easy and really useful to be able to expose implants non-surgically and allow the body's repair mechanism to heal, especially in a case like this where we can see where the implants are. We know where they are. We just need to actually remove the soft tissue debris and expose them and allow the body to heal for a few weeks before we take the secondary impressions anyway. Peri-implantitis. Again, it's an additional adjunct. It's not a replacement for traditional methods. It's an additional adjunct that will help with the sterilization and disinfection phase that will aid reattachment or aid getting rid of a lot of the bugs and the bacteria in that area by sterilizing the region and helping the body to repair or even just prolong the life of implants. I mean, in a case like this, for example, where you've got that much exposure, usually that's a complete goner. So as well as all the other potential methods of management, this is an additional aid to be able to disinfect and sterilize the area a bit better. One of the most common procedures, especially in the Middle East actually, is gingival depigmentation. And it's removing the outside or scoring the outside layer to be able to reduce the coloration on there, or the darker coloration on there, and reduce the pigmentation of the skin to be able to get a much lighter appearance underneath it. And a classic case like this, if treated well and done well, and it takes time, it's not a quick case, can actually yield some really, really nice results for patients. And these patients will be patients for life. They'll come back to you for many, many years on end because it's a procedure they're always looking to have. And because of the beauty of us having sunlight exposure on a regular basis throughout our lives, the pigmentation will come back on in their lives and they will need it to be repeated. So it's a very trustworthy type of treatment that will need to be done on a long-term basis for patients over and over again. And so just to finalize, one of the things I always say is that we are so used to having our hard tissue handpiece, our fast handpieces that are available to us every single day. But actually, it's always worth noting that the additional soft tissue handpiece, which is a soft tissue diode laser, is so useful to be able to add to your armamentarium and be able to use on a daily basis, because you'll be surprised at the number of procedures it speeds up. There's many more we haven't spoken about, such as hemostasis, pulpotomies, endodontics. We haven't spoken about whitening. We haven't spoken about photodynamic therapy with TMJ therapy. There's so many other procedures that it can be used for. And if you're interested in finding out how to use these procedures, if you have a soft tissue diode laser and you want a bit more information on it, or even want to learn how to use it a bit more on the hands-on, then do get in contact with BILD, the British Institute of Laser Dentistry, directly, or get in touch with myself. I'll be more than happy to take on any questions. And I can happily give you more information on it or direct you in terms of doing the course, because it will give you a lot of the stuff that we've spoken about. It's more of a flavor for the actual detail that we'll go into when we cover all of this. And so, yes, I hope that's been useful, and I hope you've had a bit of a flavour of soft tissue laser dentistry. It has changed my life. I did a lot of my training about 6-7 years ago now, and it did genuinely change my life and change my practice's life, incorporating laser dentistry into our day-to-day practice. See you later, and well, in fact, see you tomorrow again for the next session on 90 Day Dental. I hope that's been useful and enjoyable, and we're back on to the next topic that we'll be starting tomorrow. See you later.